Greetings and welcome to our series on addiction and family systems. I am Dr. Jerry Lewis, licensed in marriage and family therapy and in addictions counseling here in the state of Colorado. This is the first in I believe to be 4-part series on addiction and family systems. And I want to share with you, before we get involved, just a summary of what we're going to be talking about so that you can sort of prepare yourself for what's going to be delivered. We're going to feature a definition of family, and the definition of family is going to be relative to the most functional family forms. Now, we have all kinds of family forms, but I'm going to teach from what they call the 100-fold. I'm going to teach from a pattern of excellence so that we can learn from an asset-based model instead of a deficit-based model. We're going to look at family systems relative to the family unit, the extended family. We're going to look at the purpose of a family, as well as how to prioritize relationships. It's important that we understand relational priorities, especially when we introduce issues associated with what we call blended families. It's a bittersweet situation in relation to the implications of blended families. We're going to look at the family life cycle. There are points in a family's maturation where a certain crisis may unfold, which may invite, I'll call them unhealthy responses, like alcohol and other drug consumption, as well as certain compulsions. And we're going to look at them. One of them would be where the individual, the potential family unit member, leaves home, perhaps going to college, trade school, or otherwise becoming equipped to fight poverty. And then they meet someone, establish a significant relationship they've been practicing for years, and they finally decide to sort of make, I'll call it a level 3 commitment. What is a level 3 commitment? Well, many of you all understand level 1 commitment is where you and I have a chance encounter, perhaps in an elevator, passing one another on the street. A level 2 commitment is where we have interaction with an individual on a, relatively speaking, consistent basis, at least for a while. Then we have these things called level 3 relationships. We want to equate level 3 relationships to marriage, but more often than not, we are compelled to equate them to brothers and sisters, grandmothers, grandfathers, mothers, fathers, perhaps cousins, relatives. Why? Because we're with them until death do we part. A marriage vow has a lower probability of being kept, of course, than, say, a blood family member. So we have level 3 relationships that are established. One day we're going to learn how to establish them healthily through a marriage relationship. Then we have another phase where the young children come in. We have babies that are born to these family units, and that's a trauma. And we're going to look at that because that's a portal relative to issues associated with addiction and sometimes issues associated with violence, domestic violence in relation to, say, the family unit, and maybe sometimes, unfortunately, child abuse and neglect. We also have the children emerging into adolescence, which brings another set of thriving skills. I was tempted to say coping skills, but we're talking from an asset-based model. Then we reach a point as a family unit where we launch the children out. They move on, and what do? They establish their own family units. And then as the couple of interest emerges in relation to senior citizenhood, they deal with a number of issues, just staying healthy, staying alive after a while. So we're going to look at each of those portals in detail. Why? Because understanding the portals, understanding the benchmarks, understanding the family nodes in relation to its evolution gives us some hint relative to issues associated with maladaptive behavior. We're also going to consider the individual life cycle. And here we're going to borrow from, say, Piaget, perhaps Freud, in relation to understanding the various points of transition, including the process of resolution. We're going to start, of course, from birth to the age of 2, and most of you all understand learning to deal with trust and hopefully develop trust. But there's always the possibility, if it is not resolved appropriately, that the issue of mistrust will occur and prevail, which contaminates the whole evolutionary process. Then we have, from ages 2 to 6, this thing called autonomy versus shame. And this is where, if there is going to be some paranoia, usually it gets caught up between the ages of 2 and 6. Then we have what we call the middle childhood. And here is where we learn to take initiative. But if we're not careful, and if we are not given proper instruction in relation to the growing pangs, we may wind up being preoccupied with issues of guilt. And then when we reach adolescence, we identify the issue of being industrious versus inferiority. If we're going to have inferiority complexes, they usually emerge in relation to girls ages 11 to 13 or boys ages 12 to 14, not resolving this point of transition. Then we move into older adolescence, and this is where we're going through an identity crisis. And many of you all who are parents of adolescent children, perhaps 13 or 14 up through 21, you know what I'm talking about. They have identity crises. They go along with the crowd. They are very concerned about fitting in. And they're trying to decide, am I going to be a grown-up or am I going to be a little child? I find that when they're safe, they want to be really grown up. Then when they get in trouble, they want to turn into little children. And it's an important part of the responsibility of parents to allow the children to experiment with the variety of roles, keep their self-esteem intact, or at least facilitate it, so that they can become identifiable relative to who they are and where they fit, and that there won't be any role confusion. Because if this point is not properly resolved, then, we move around saying, I've got to find myself. Whenever you hear somebody who's, say, 45 saying they have to find themselves, understand they did not resolve the adolescent component, the latter part of their adolescent years. And then we're going to look at intimacy relative to isolation. This is the early adulthood. This is where we start finding mates. I'd say between the ages of 21 and 35. Now remember, I'm sharing from what I call the 100-fold model. I'm sharing from models that work. I'm sure that many of you all are saying 21 to 35, that's awfully old. In this highly technical society, in this day and age, we have to teach our offspring how to manage their lives appropriate to optimize their capacity to thrive, procreate, and teach proper skills. And so when we talk about it, I always tell kids, don't even think about a serious relationship until you finish whatever training you're going to get for your personalized, professional, and emotional acuity. And so, 21 to 35 is not an impossible range in relation to the capacity to choose well, live well, love well, marry well. We'll talk more about that as we move through the series. And then, we move into what they call middle adulthood. They call it middle age. Do you know that middle age starts at about 35? Yes, it does. And it moves on until about 50 or 55. And in relation to that piece, we're trying to get that last boost, trying to generate, trying to create. And there's the issue of feeling like you're going to be stagnated. It has to be resolved. And that can move on into senior citizenhood. And and I know senior citizenhood starts at about age 55. That's when you can join AARP. That's when you can get discounts at a lot of the food eatery places. places because you're seen as a senior citizen. Now, that doesn't mean that you retire. It doesn't mean that you stop working. It doesn't mean that you can go fishing or wherever you want to go. But what it means is your attitude matures. And then I guess at about the age of 70, 75, perhaps even later in this day and age, you reach a point where you are integrated. Either you feel very, very satisfied and fulfilled with life, or you move into a state of chronic despair. And these are what I would call the individual life cycles. And we're going to look at how these individual life cycles sort of map onto the family life cycles. And we're going to, talk about what happens when things